My name is Dr. Stephen Amoak. I'm a general practitioner at the Presbyterian Hospital in the Upper East region of Ghana. I first heard about the Merck Foundation scholarship for postgraduate online studies sometime in June 2020. And about a year later, having put in an application, I was granted an interview. Thereafter, an offer was made to me. And so, sometime in February of 2022, I was admitted to start the Postgraduate Diploma in Acute Medicine with the University of South Wales. Prior to commencing this study, I worked at the emergency room of my hospital, the Presbyterian Hospital, Boku. And it was while working there that my interest in acute medicine, or for that matter, emergency medicine, was piqued. And so when Merck Foundation granted the opportunity, when I glanced through the list of courses they were sponsoring, it was quite easy to select acute medicine as that readily appealed to me. Pursuing the course has granted me enhanced knowledge and skills in the field of acute medicine. And the patients that stand to benefit directly from this are the patients I'm directly responsible for, my facility, the Presbyterian Hospital in Boku, my community Boku, and I have to admit, and myself as an individual, because my skills have been enhanced. Now I'm proud to, or just a few years ago, we tended to see up to 30 patients a day at the ER, and it was busy, and we saw all manner of cases. Some had to do with metabolic disorders, diabetes mellitus and its complications, including diabetic ketoacidosis. We also attended to cases relating to the cardiovascular system, such as acute coronary syndromes, severe hypertension, and neurological disorders such as stroke, in addition to injuries and accidents relating to motor vehicle accidents. Although as a general practitioner, I did have some training to attend to many of the cases we tended to see there. There was a gap, there was a deficit. I definitely couldn't manage every possible case, and there were instances I would have to refer my team and I. But having pursued this course, I've had an enhanced knowledge of and appreciation of some of these same conditions, and now I'm even able to diagnose some conditions that hitherto I would not have been able to diagnose. An example of one such diagnosis would be euglycemic diabetic ketoacidosis. I had never heard of this diagnosis before until I undertook the postgraduate diploma in master's training in acute medicine. And so I can only imagine how my approach to such a diagnosis would have been had I encountered such a patient with the condition. Now I know it's almost the same as diabetic ketoacidosis, the only difference being that these patients tend to present with normal blood sugar levels rather than the usual elevated blood sugar levels. For this reason, or this particular example illustrates what I mean when I say I have acquired enhanced knowledge in the care of patients with acute medical complications. My plan is to first and foremost share what I've learned with my colleagues, the other doctors and nurses and other health workers I work with at the Presbyterian Hospital. Having acquired additional knowledge, my intention is that from time to time, over a period, I can also hold some form of refresher training for them on some key diagnoses that are worth recognizing early. It is my goal that going forward, I can pursue additional studies in the same field or related fields. Specifically, I might go on to pursue a doctoral training in the field of acute medicine or its related program, so I can better enhance myself in delivering quality of care to my patients, as well as being useful to my hospital and community as a whole. On this note, I want to say a very big thank you to the Merck Foundation for the opportunity. It's been an excellent and rewarding learning experience.